Hello and welcome, I'm Dr. Nathan, and today we're going to be talking about the iliotibial band syndrome. Okay, so the iliotibial band, or the ITB band, it sits on your hips over here and it goes all the way down and attaches to the outside of your knee. Okay, the ITB we commonly see in people that are runners or also jumpers, as well as other athletes. Okay, and what they might experience is this deep burning pain, and also it could also manifest as a dull ache. Okay, now what we tend to find is that the ITB has become tight or hypertonic. Now the question is why? If it's one-sided, we're thinking that there is some kind of muscle imbalance. It could also be from repetitive motions. It might also be from a trauma, so you might get knocked from the side. It goes tight to basically protect the joint. Okay. Now, in terms of treatment options for your ITB, there's a wide range of things that you can do. You'd be looking at commonly things like soft tissue techniques to release that ITB. You'd also be looking at things like massage or acupuncture. We as chiropractors would also be looking at adjusting the hips, okay, also the pelvis and also the lumbar spine, okay, and that's to look for any dysfunction that's in those areas, right, that could be causing that ITB problem. Okay, now if it is one-sided that you have that ITB problem, this is where basically you want to be looking at rehab exercises, and that might be, you know, just to help out with those imbalances. Okay, now in terms of assessing this, it's very important that we assess the lower back and also the hips, because if there's dysfunction in those areas, we're also going to have problems with that ITB. Now, if you were to come see us as a chiropractor, this is where we're doing orthopedic tests and also neurological tests to make sure it's an ITB problem and not something like a disc or a facet syndrome. Okay? If you'd like to know more and if you have any other questions, feel free to give us a call.